that's when we'd be moving ahead. That's when we'd be expanding our gathering sizes. Certainly, there's lots of conversations about the ways we'd like to continue to reopen, but we need that case number on the decline and really down below 100. If we see it go the other way, as soon as we are back over 200, and I say as soon as because I do expect, given what we are seeing around the country, that we will likely see some additional increases here. When we get back above 200, we're back in a high incidence state. And for me, that means we are back in a state. It does not equal an automatic rollback. What we do when we are over 200 new cases is look at our local epidemiology, our local data, and say what is driving that increase. So if we see, for example, a lot of cases that are associated with bars. Bars would be one of the earlier things we might think about needing to roll back. If we're seeing pockets in long-term care facilities again, we would double down on our efforts in long-term care facilities. We'll use the data to make the decisions if we need to make structural differences in our guidance. I do want to point out, though, that red, that 400 plus cases. That, again, would be approximately twice the number of cases that we are at right now. But if we get to a point where we're up to 400 cases per day, that's the equivalent of where the states are that we are requiring quarantine for our visitors. It's the equivalent of needing to go back to a phase 3, really pulling back on major activities. I wanted to make the point with the mayor that we're quite close to 200 here. We'll start thinking about pulling back if we need to once we're over 200. There are other play in there. How fast are we seeing a rate of increase? What's happening with our percent positivity? Are we seeing any impact on the healthcare system? We continue to follow all of those metrics, and they all play into our decisions. But for you following every day how we're doing in Chicago, that's the number I want you to watch, and I want you to help us, as the mayor said, drive that number down. It's how we move ahead in Chicago and not backwards. I also just want to highlight that we are doing more testing in Chicago than we've ever been doing. We set as a goal that we needed to be doing at least 4,500 tests per day. That means that we're testing % of Chicago residents per month. Our current average is at 5,562 per day, sufficient to where we are. We'd like to continue to grow that, but it's good and been going up. So this is not that we're testing less, for example. Our percent positivity can be calculated two different ways, and I'm going to mention this just because we've been getting a lot of questions about it. If you look on our dashboard right now, we calculate our percent positivity by the number of positive tests divided by the number of individuals who are tested. We only count an individual once. However, many other jurisdictions do use the total numbers performed. So if an individual has had multiple tests done, those would be multiple times. And so overall, the way that we've been reporting on our dashboard, we're at a 5.3% positivity, and that's an increase. We'd like that number to be below 5%, working to drive it down. But where we're comparing across jurisdictions, in many cases that lower number, that 3.5%, is actually where we are as a city. It's not that one is right and one is wrong. There are different ways of counting the percent positivity. We use this data to drive resources to where they are most needed. Where we are seeing the highest percent positivity in the city is where we push pop-up testing. It's where we do extra investigation. It's where we do additional out. We will continue to do that. Our daily hospitalizations and deaths look great at this point. Our hospitalizations continue to decline. We have fewer people, by and large, hospitalized, fewer people in the ICU, fewer people on ventilators in Chicago than we've had for COVID at any point since March. We also have fewer deaths per day than we've had at any point since March. At the peak, we were averaging almost 50 deaths from COVID-19 every day here in Chicago. We're now down to 4 deaths per day. And we've had a few days with just 1 death. I anticipate likely soon we'll have our first day, finally, with no COVID-19 deaths here in Chicago. But this progress is because we've managed to keep our cases relatively flat. If we start to see significant increases in those cases, hospitalizations and deaths likely will follow. And that's what we're seeing around the country. Jurisdictions that have seen major increases, the jurisdictions where we've put quarantine in place, people returning to Chicago, they are now starting to see those increases in hospitalizations and in deaths. We do not want that here in Chicago. We do not need to see that here in Chicago if we can continue to do the things that have gotten us this far. Finally, I wanted to talk a little bit about what we're seeing related to age groups, because this is a really important part of the story. This is, again, data right from chi.gov/COVID-. I encourage you to explore it. This shows what our daily case rates have looked like by age group, all the way from March through July. So do you see that gray peak in May? That was in Chicagoans who were over the age of 80. So in early May, where we were seeing all those deaths, that's when we were seeing a lot of cases, especially in long-term care, a lot of people with underlying conditions being admitted. Our older Chicagoans were seeing the most cases. We've made really good progress there. And if we move ahead to what's happening today, that blue shows you really over the last month. Yep, go ahead. And now instead, we are seeing the most cases in Chicagoans who are 18 to 29. Followed by 30 to 39, followed by 40 to 49. Our case rates in older Chicagoans who are more likely to be hospitalized or to die are the lowest, not counting the youngest children under 18. That's great. But younger Chicagoans are not immune to serious complications from COVID. National news was made here in Chicago when a young woman in her 20s without significant underlying medical conditions needed a double lung transplant for COVID-19. We have seen hospitalizations and we have seen deaths, even in these younger age groups. But also, people in these age groups spread COVID just as easily as someone who is older. And so especially if you're in a younger age group, I'm not surprised that you're out more. You're at a lower risk, it is true, for these serious outcomes. But if you have in your close circle people who have underlying conditions, or especially people who are in those old age groups, I also need you, in addition to all the things that the mayor mentioned that help protect the family, I need you to be extra careful with those vulnerable folks in your life. Because you could have COVID and not even know it. It's been one of the things that's made this disease hardest to spread. And what we don't want to see is those cases in our younger Chicagoans in a few weeks translating to increases in older Chicagoans. So since June 15, 29%, most new Chicago cases have been in that younger adult age group, and you can see the drop moving forward. And where we look at race and ethnicity, it's no secret here that most of our recent cases have been among Latinx Chicagoans. We've seen very, very good improvements there. Rates have been dropping. I really want to thank everyone in that community that has been working so hard to control the disease, to get the message out, to push testing, to push investigation. And you can see that among Chicagoans 18 to 29, again going back to June, we've seen some drop-off in terms of cases, but still relatively high rates among younger Latinx Chicagoans. We've seen the most increase among white non-Latinx Chicagoans in that 18 to 29-year-old group. And among black non-Latinx Chicagoans, you can see it's sort of been meandering a little bit up and down. The bottom line is that we are seeing these cases among all race ethnicities. This is a message for all Chicagoans to be careful. I also just want to highlight that our testing and our percent positivity have been relatively stable in this age group. So again, this is not just an artifact of changes in testing. And this is an important graph. It highlights that in virtually every zip code in Chicago, in our most recent week, we saw new cases, not just in Chicagoans, but in Chicagoans between 29. So every zip code just about is seeing cases. We're seeing the most new cases in the 18 to 29-year-olds in 60614, which is the Lincoln Park area. The areas that are darker are where we are seeing more cases. The areas where we are is lighter is we're seeing fewer. But the bottom line is we're seeing these cases throughout the city. We're seeing changes in COVID cases, again, in that 18 to 29 for the most recent week. We see the increase again in that Lincoln Park area as well as in New City in the south. The areas in green are where we're seeing decreasing rates. The areas that are in orange and red are where we're seeing increase. Again, bottom line, this is across the city, and we need everyone to take care. So, in summary, I'd like to just first of all, thank you all for having gotten us this far. Our healthcare systems, patient and outpatient, our community-based groups, individual Chicagoans have all stepped up to take care of each other. We've managed to keep a decision like whether to wear a face covering out of the realm of politics and in the realm, this is the right thing to do. When I wear this face covering, I protect my neighbor. I was in Michigan to visit some family over the weekend, and I was amazed to go into a grocery store and see almost no one wearing a mask. When I was out and about, I was seeing very few signs that people were taking COVID as seriously as they are here. And when I talked to my counterparts in states around us, and in some cases other jurisdictions outside of Chicago, even within Illinois, I think there is wishful thinking happening that is over. It is not over. And now, more than ever, we need you all to do the things that have gotten